Here in the heart of Kansas City, where mornings start with a run along the trails, weekends mean pickleball, golf, or playing with your grandchildren. Staying active is just part of who we are. Your health matters. At Dohrmann Chiropractic, we believe living well means moving freely, feeling strong, and staying pain-free, so you can keep up with the life you love. Our office is a welcoming space dedicated to helping Kansas City's active community heal, recover, and thrive through thoughtful, personalized chiropractic care. Dohrmann Chiropractic is here to help keep Kansas City moving, one treatment at a time.
People that come in here, they're looking for a solution. They're looking for an answer. And a lot of times we're their last stop. And so we have to get up every day and come in prepared to do our best to help them. And if we can help them, that's our purpose. And they go out here, outside of the office, and they can fulfill their purpose. And that's why we do what we do.
I was rear-ended by a semi-truck. I was knocked unconscious. It was just a bad situation, but it started causing all kinds of back and neck issues. So I've been going to chiropractic for many years.
I think it was just years of wear and tear. I was a college volleyball player, very active, and I just had constant back pain. And when I went to a specialist, I was just told to lose weight. And so I thought, maybe I did. So I did. I lost 45 pounds and started working out really good. And it was still painful. You know, I just had shooting pain down my legs. I had the back pain. It started to not allow me to do the things I wanted to do. Like I had to give up gardening, running was a little bit harder. So it definitely impacted my life.
Any type of joint, when you do construction work, you're twisting, turning all the time. So I have a left hip that give me some problems. I've never had to have surgery, but I always came in and got adjustments. And so now the process is I'm using DRX to decompress the vertebra and get me back 100%.
So yeah, since 2009, we've provided chiropractic adjustments. And I started to realize there were a lot of cases that responded well to chiropractic, but sometimes I would have to refer out for injections or pain management, which is fine, but a lot of our patients would prefer to correct the root cause if possible. And so that's why a few years ago I added in DRX9000, which is disc decompression, and also SoftWave tissue regeneration. And it's really helped a lot of our patients to avoid masking the symptoms, and it's been really fun to watch that process.
So what exactly is the DRX9000?
So the DRX9000 is a disc treatment. It's the most researched disc decompression system in the world. And what it basically does is if we have a disc that's injured, or a lot of times there's compressive load, for example, think about someone that sits all day at work and over time the lower back starts to get compressed or the neck starts to compress. Well, if it compresses too far, the disc material, that spongy material, will start to bulge, start to kind of squish out. And if it goes too far, it'll start to sit on the nerve, and that's what causes pain. DRX9000 works to open that specific disc level, and then the disc can resorb back in, taking pressure off of the nerve.
The DRX9000 pulls on the spine using logarithmic curve, which is a type of pull that's been proven under scientific scrutiny to be able to achieve true decompression. And that study was published in the Journal of Neurosurgery by Dr. Ramos and Martin.
I've been treating patients with DRX9000 for approximately 20 years. And I've been very impressed with the clinical results. 90% of the patients are significantly improved.
One of the features of the DRX9000, which allows us to be successful in treating difficult spinal conditions, is the ability to very precisely change the angle of pull to target a specific disc level in the neck or in the lower back, so that you get targeted decompression of the area of the spine that needs most attention.
But they've gone from a pain level of 9 to maybe 1 or 2 or something like that. A lot of them are asymptomatic. And you know, it's very impressive. Does that treatment last? Yes, it lasts. And so I have a lot of patients. I never see them again. And some of them had large extruded herniated disc with blockage of the central canal, and they're back doing even normal activity. You know, I've treated over 1,000 patients with both the lumbar and cervical DRX9000 unit, and the improvement is seen in all areas.
The DRX is the most amazing experience. It's very relaxing and comforting, but I know that the table in itself is designed to kind of create this space in our backs and the spine. And so I think it's able to kind of release all that pressure from just sitting on top of each other, and creating space is the key. I am way more active. When I get up in the morning, it's not a wonder of, okay, I wonder if I'm going to be able to get groceries today. I wonder if I'm going to get to work out today. I sign up for those workouts the night before because I just feel so confident in how far it's come in just such a short amount of time.
What the DRX has done that I have noticed is my motion. I'm able to turn better, more flexibility, because you know, when you're running drills and cutting boards and running saws all day long, you tend to bend over. So it really does help me straighten up. I have found myself correcting my posture. It doesn't make sense to me to wait till you don't feel good and then be forced to pay when, if you're proactive, then it's the wellness side. And I'd rather pay for the wellness than I would to put the money out for a surgery or anything like that. So it's very important to be proactive on your health.
What about SoftWave? How does that work?
And the way SoftWave works is it emits sound waves into a joint, and the sound waves work to break down damaged tissue. So when the damaged tissue gets broken down, then the body goes to work on healing, which means it recruits stem cells to the area and starts to regenerate the tissues. SoftWave, actually the reason I got into SoftWave is I kept having a lingering shoulder issue, and in the case of my shoulder, it worked very quickly. It started to break down the damaged tissue, I could move the shoulder better, and the pain was gone after several sessions.
My left shoulder, like deep into my shoulder blade, it just ached nonstop, and I could not make it go away, and that was there probably 10 years or more. So I tried SoftWave therapy on it, and all I did was 4 treatments, and I've never had an issue since.
A year or two ago, I started playing some basketball. I noticed some pain in my left knee, and it had kind of been going on and off for over a year and a half, and then was coming in just for a normal adjustment, and I saw the SoundWave ad, and I thought, yeah, this would probably be beneficial for me. I looked into it, and maybe 5 treatments, that's when I really noticed it the most. We were doing a workout maybe about a week ago, doing some sprinting, and I just noticed huge strides, and I could just feel more explosive strength, less pain for sure.
The healing process starts from the second the patient walks in the door. So if we're greeted with a smile, that starts the healing process. You know, there's so much stress in the daily life for all of us. So when patients come in here, we want them to feel that positive energy. We want to give them a smile, a hug, and just give them some love. And if we start the process there, and all of my team members do an amazing job of that, start the process there, and then they get an exceptional treatment that actually helps them physically with their issue, then the odds of success are extremely high.
The staff is great. I mean, the people here really care about people. They care about, they know the natural way to heal a body. They study it, they stay current on it, and we're dependent on that. So I completely felt comfortable. Dr. Dohrmann, Dr. McFadden, all the doctors here are great. The staff running the machine is great. I couldn't ask for more security, more peace in doing it, because you are nervous when you go for a new procedure. You don't understand. So I've always felt completely comfortable doing it.
I would say my goal for patients that come in here is we want them to be heard. We want to know what their goals are and how their issue is affecting their life. And then we want to work with them to get that quality of life back. So if, for example, a grandmother comes in and she can't lift her grandkids because of the pain, that's our goal. Can we figure out the root cause of the issue? Are they a candidate for the services we provide? And let's get them back to lifting their grandchildren or whatever activity is limited in their life.
Take the next step toward moving better and living pain-free. Schedule your visit with Dohrmann Chiropractic today and let us help you stay active, healthy, and doing what you love in Kansas City.